So let's talk about substance abuse from a trauma frame. Now, alcohol abuse disorder is similar to some of the other disorders in that we're seeing a problematic pattern of the substance leading to clinically significant impairment or distress with at least two of those symptoms occurring within a 12-month period. And the more symptoms, the more severe the disorder. There are problems with use. So, it may be taken longer than expected. It's hard to control, hard to cut down. You're doing things in order to get it, a lot of cravings, or it may interfere with the rest of your life. Failure to make it to pick up your kids or make it to work, or put dinner on the table. Maybe problems with your relationships as a result, or maybe you've just stopped doing those. Sometimes what people report is that they've stopped doing the things, or that they are doing things that are physically hazardous, like drinking and driving, or drinking while doing construction work and operating a bulldozer. Some people will continue using substances even knowing that it's causing health problems. They have diabetes, and in addition, they're drinking, and they know that that's a bad idea. They may report tolerance, so previous amounts of alcohol no longer are effective, or withdrawal when they miss, and so things like headaches the night before, or or night after drinking, that's a kind of withdrawal, or more serious kinds of withdrawal symptoms. So let's think about substance abuse and trauma. So about, in one survey of teens, approximately half had a substance use disorder before they experienced a significant trauma. So we're not talking about it being a necessary cause, but something that we might see. It seems to be reciprocally reinforcing and bidirectional, that trauma puts people at risk of substance abuse, but also substance abuse puts people at risk of trauma. Teens with a trauma history, may use substances as a way of controlling, self-medicating some of the symptoms. So flashbacks or memories or hyperarousal, clearly unpleasant, and they may want to be doing things to prevent them. Finally, when we're seeing both PTSD and substance abuse, we're seeing greater problem severity, more problems in terms of how they're functioning relative to those people who only have one. Now, we see a lot of comorbidity. So, if we're looking at mood disorders, we see, a considerable number of people with some sort of substance abuse disorders. Similarly, we're seeing a lot of people with some sort of anxiety disorder. That's not very surprising. This is Barbara Amaya, who has a history of being trafficked as a teen and young adult, and also has a whole series of problems, including substance abuse. And she says acid, LSD, marijuana, speed, hashish, even heroin I tried them all and found out immediately that they made the bad memories and feelings disappear. Roxane Gay, who was gang raped as a young teen, is not abusing substances, she's abusing food. And she says, when I was 12, I was raped, and then I ate and ate and ate to build my body into a fortress. I was a mess. But then she says, I grew up and away from that terrible day and became a different kind of mess, a woman doing the best she can to love well and be loved well, to live well and be human and good. And I want you to be thinking about both of these things may be happening as we're talking about any sort of disorder, that people make mistakes and have problems, and also can work on making fewer mistakes and loving well and living well. This video has a series of people talking about their trauma histories and also their substance use. So it may be helpful to pay attention or to review this. So think about substance abuse disorders and how it might be seen from a trauma lens. We already talked about it being possibly self-medication, or that it may put people at risk of trauma. Probably, Roxane Gay at various points talks about herself as not really being worth anything better. So that may be another way of thinking about it. Think about the explanations that one would give for why someone might be abusing substances. And with that, I'm going to say goodbye and have a good day.